Hey everyone, it's Dr. Eric, the fitness physician, where I talk about all things related to muscle medicine, hormonal fitness, longevity, anti-aging, and much, much more. I've been doing a series on recovery from training, recovery from injuries, and much, much more. There's a multi-part series. It's kind of talking about this because this comes up a lot, certainly with my clients, I'm sure with a lot of other clients as well. We all want to recover from any injuries. We want to keep training, keep doing the things we like to do, whether it's on the field and the track or at home. And I want you to maintain yourselves in optimal condition. Like I always say, train hard, but recover harder, right? So these are some more other modalities, kind of a mix of things. Some are in terms of like oral, what can you take, right? Probably the biggest one I recommend for a lot of people is collagen. A quality collagen peptide is integral. It's going to help you repair, right? It's going to help, it forms the building blocks of everything in terms of related to your soft tissues, your collagen tissues, which is everywhere in your soft tissues, your tendons, your ligaments, your joints, your muscle, even in your bone and your muscle. It's very important for recovery. And these collagen peptides are a great source of peptides and general proteins as well. Non-methionine related, meaning they're not going to affect your insulin or anything along those lines. It's some, for example, a lot of people want to do something fast, right? Take some collagen in the morning with your coffee, totally fine. But I agree, I think you should be taking it all the time anyway, regardless of what your concern is about fasting or insulin status, because of what I just mentioned, because it's going to help your body to heal. Not only important for the soft tissues, but also for the gut. It's great for healing for the gut. It's soothing. People like to do things like bone broth and things like this, and that's great. It's another great source of collagen peptides. Or you can just get a supplement, right? It's just a powdered form. Again, get a quality source. I use a couple, one's Pure, P-U-O-R-I. It's been tested to be free of all metals and contamination. In other words, Great Lakes collagen, hydrolyzed peptides, and several of the supplement companies I work with also have their brands. Numedica's has a great collagen source, and it also comes in a liquid form, which is great because I put it in my pre-workout shake. It's very easy to use, so Numedica is a great source. Several other supplement companies I work with have very quality products as well. Numedica, Orthomolecular, Metagenics, a few others have great quality collagen peptides as well. So little tip, take it with maybe a small amount of vitamin C, right? As little as maybe 15 to 20 milligrams of vitamin C. It's not very much. Possibly even some juice would be helpful. It would be simple to do this, or you could just get some powdered vitamin C, but a little bit will help because the vitamin C is also integral for collagen production in terms of all the little subcomponents of that collagen, the proline, the lysine, and the other amino acids. Vitamin C is integral for proper collagen formation. So it's something to be taken multiple times a day. I highly recommend it on a prophylactic basis. In other words, take every day for preventive to maintain the structures of your soft tissues, your collagen, joints, tendons, ligaments, but it's certainly, if you have an injury, load up on this as well. What else can you take? Obviously, if you have a nutrient or a mineral deficiency, this needs to be addressed, whereas most people are deficient in things like magnesium, zinc, which is also important for collagen production, and other minerals and nutrients that can be assessed for on a good exam, a good history, and mineral analysis, or even other testing. But glycine and glutamine are also integral as well. You'll get glycine in a collagen source, but you can take glycine on top of that, which again, a lot of people are deficient in glycine. That's something you could take at night to help with fat burning, to help reduce inflammation, to help heal the gut, to help balance out your methionine intake. A lot of us just load up on meat. If you're not eating organ meat or a balanced, full source, head to tail kind of organic, we can be getting a lot of methionine. A lot of studies, people talk about fasting or not eating meat because they're concerned about too much methionine and caloric restriction and fasting, how it can help you live longer. Well, a lot of studies have shown that simply by doing some methionine restriction or even balancing out your methionine with additional glycine, the benefits are the same. So you don't even have to fast. You don't even have to do caloric restriction. You can get the same benefits just by supplementing with glycine or balancing out your methionine. Or some people do a methionine fast or protein fast periodically, and that's fine too, but simply add some glycine and you're going to get the benefits of glycine, which is for soft tissue healing and gut health, and also can help at night for fat loss and curbing appetite. So it's a great combo. Glutamine is also awesome for gut healing, promoting immune support as well, and helping your body to recover from training and workouts and building muscle from post-recovery. So I love glutamine and I love glycine, the double G, right? So that's easy. Also, there's some hands-on treatment, right? There's a ton of this, right? OMT, osteopathic manipulative therapy. I'm a DO. I used to do a lot of manipulation. I don't do as much anymore, but I can still do some. We're using soft tissue techniques, myofascial techniques, what we call direct and indirect. You can use movement patterns, active and what we call active and passive release, in addition to soft tissue stretching. And of course, everybody thinks of like the cracking, right? When you go to a chiropractic care, you get bone, you get aligned, right? There's a right way to do it and a wrong way to do it. I'm not going to get into that here, but chiropractic care and OMT is awesome for removing restrictions, enhancing mobility and stability, and improving discomfort and getting you back in action. Prolotherapy and PRPs is, I've done a lot of this as well, where you're injecting prolotherapy, which is typically like a dextrose-based solution, or PRP, using your stem cells, your blood, your platelets drawn from your own blood, to inject into certain body parts for soft tissue healing. These two modalities are awesome as well, very effective. Obviously a little bit more invasive because it's a needle, but it's a tiny needle. It's very easy. I've done it to myself, I've done it to many patients, minimally invasive. It's very almost pain-free if you do it properly, but great for healing and speeding up, especially for acute injuries. It can speed up that healing process, helps your body to lay down new tissue. It stimulates an actual inflammatory response, mildly so, to get those cells into the tissue to make it heal faster and better and stronger. So definitely can speed up the healing process post-injury. So check that out, Prolotherapy and PRP. Make sure you work with someone who's trained and certified in this as well, because this is, since it is an invasive procedure. Acupuncture and cupping, acupressure, again, minimally invasive, if at all. Cupping, these are ancient techniques that have been around for centuries, highly effective as well for improving, reducing inflammation, getting blood flow to the area to promote the healing process. Dry needling is another one. Obviously, it can be a little uncomfortable as well, but also effective. Dry needling and myofascial release are also some hands-on techniques to actually get, again, stimulate some inflammation to the area to get cells into the area to heal. You're going to hit those myofascial trigger points, again, to release that tension and improve healing as well. Same with scraping. And of course, good old myofascial release, as I mentioned, and deep tissue massage, and good old physical therapy, right? Especially if you have an injury or a restriction or a laxity, or if you just have an abnormal movement pattern, which is sometimes the problem. Sometimes you have an abnormal movement pattern, get assessed by a good PT or who can look at you and maybe fix that and nip that in the bud. So if you're always getting a nagging injury from a certain movement, maybe something's off on your form. Maybe you're not doing something right. You need to get that addressed. And then therapy can not only get you back on track, but fix it so you don't get it again in the future. I recommend all these as needed, but obviously if on a regular basis, everybody should be trying to get a good massage, ideally once a week, once a month, a couple times, go and occasionally get some acupuncture, some cupping, some PRP, or some chiropractic care, some OMT, easy, minimally invasive. Obviously if you have more severe injury, that's when you want to step it up, maybe do some more acupuncture, prolotherapy, or PRP, scraping, and dry needling and things like this. All highly effective when used at the right time. So I've done and tried a lot of these and worked with a lot of these myself, so I can vouch for them. So a couple more big tips. Next video, I'm gonna do a couple more therapies, and that'll wrap up this session on healing and recovery. So check out the next one, some cool advanced stuff. So everyone like this post, tag it, share it, let me know what else you want me to talk about. Anything, anti-aging, fat loss, muscle building, living longer, living stronger, living better, gut health, epigenetics, longevity, autophagy, fasting, you name it, I can talk about it, and I love it. Check out my courses online. I'm going to be launching some paid courses soon, a ton of free content. I'm doing one-on-one consultations all across the country as well. So check out drericprimex.com and find me on social media. Let me know, light up this post, let me know what else, and everyone have an awesome day. Happy Friday, and we'll talk to you soon. Bye.